Technology Symposium 2021, sponsored by the Alabama Department of Rehabilitation Services, the Alabama School for the Blind Alumni and Workers Association, and the Alabama Institute for Deaf and Blind. CEU Open Code 39543. Our presentation will begin shortly. CEU Open Code 39543. Our presentation will begin shortly. CEU Open Code 39543.
Hello, and welcome to our training on job accommodations for post-COVID syndrome. My name is Michael Papp. I'm a rehabilitation engineer with the Alabama Department of Rehabilitation Services, and I have over 20 years of experience in providing job accommodations and other types of accommodations for children and adults with all different types of disabilities. Today we are going to be discussing something that's been in the news lately, post-acute COVID-19 syndrome, which has been affecting many people who have had moderate to severe cases of COVID-19. We'll discuss the symptoms that people are experiencing after they have recovered from the infection and go over some accommodation ideas, as well as a very brief discussion of how a person can go about requesting a job accommodation from their employer. So what is post-COVID syndrome, or as the literature calls it, post-acute COVID-19 syndrome? They're persistent symptoms that an individual will have after they have recovered from the initial infection. And patients who have had both mild and moderate and severe COVID can experience some sort of residual after having recovered. These symptoms can persist for months. Some people in the news have anecdotally had symptoms for over a year now. And according to some of the medical literature, people who have recovered from viral infections like COVID-19 can have symptoms for up to 2 years. Usually they resolve themselves after a certain period of time. The cause for post-acute COVID-19 syndrome is as of yet unknown. So some of the possible symptoms are fatigue and brain fog, headaches, sleeping difficulties, joint pain, shortness of breath, cardiac issues, and some other less common ones. What we're going to do is go over each of these symptoms or groups of symptoms and talk about some possible accommodations that might work for somebody. So one very common symptom is fatigue, and accommodations for somebody who is experiencing fatigue on the job would include frequent rest breaks, offering a flexible work schedule, allowing the individual to telework so that they don't have to commute, which would reduce fatigue. An ergonomic assessment might be appropriate depending upon the type of job and job tasks that they have, and also looking at workflow improvements, ways that they can reduce their energy exposure while working. This might be incorporated as part of an ergonomic assessment. Brain fog, and I have spoken with several people who have recovered from COVID-19 who have mentioned this particular issue. This is where people have difficulty with concentrating, especially for prolonged periods of time. And so accommodations for brain fog would include providing a workspace that has less distractions, using a white noise machine or noise canceling headphones, structuring someone's job so that they can work for uninterrupted periods of time, so that while they're trying to accomplish a complex task, they don't get interrupted and knocked off task. Implementing memory aids can be very beneficial, such as using a schedule on your phone or using a digital device such as a Google Home or Alexa device with a scheduling app, as well as providing clearly written processes and flow charts as to how someone needs to go through a particular process might be beneficial. And also looking at concentration, organization, and other types of memory apps. Headaches may also be very common. In the case of when someone has headaches, we are always looking for ways to reduce the triggers in the work area. Um, a lot of times we find light, especially fluorescent light bulbs, the bluish colored ones tend to cause people to have headaches. So we look at ways to provide softer lighting, maybe some less glare. If you have a south-facing office or an east-facing office in the morning, the sun can cause a lot of glare and might cause headaches. So we look at ways to reduce that. Also providing flexible scheduling so that if someone's experiencing a severe headache, they may be able to shift their work hours so that they aren't working when they have a headache. For example, if someone tends to have a headache in the morning, we may want to shift their work hours or request that their work hours are shifted to later in the day. Also, providing telework can be very beneficial, especially because it's easier to reduce triggers in a more controlled environment versus someone who might be working in a cubicle or an open office area. Sleep difficulties are also very common. And again, accommodations for this might include things such as allowing a flexible work schedule or for people to telework, allowing workers to have more rest breaks or more frequent rest breaks, um, helping keep the workstation temperature cool. And I know for different people, especially between men and women, have different optimal temperatures, work area temperatures to keep them productive. But a warm work area, if it's especially if it's a little too warm, will tend to cause people to go to sleep. And also allowing people to have cold drinks at their work area if there's a policy against that. That could be a possible accommodation. Another possible effect is muscle weakness. And for this, we would suggest implementing an ergonomic work area or during an ergonomic evaluation to determine if there are ways that we can provide equipment or modify job tasks or the way a job is done in order to accommodate someone who's experiencing muscle weakness. Another potential symptom is joint pain. And again, with this, allowing someone more frequent rest breaks if they have a job, especially where they're standing, to allow them to have a stool to sit on if it's affecting their knees, hips, ankles, etc. To provide an ergonomic work area or an evaluation to determine if we can improve their workflow or ergonomics so that their joints are under less stress. It's also possible to request a restructure or reduce physical job duties, and also to allow telework if it's appropriate for the job. Another very common symptom is anxiety and depression. Um, and so some possible job accommodations for someone with these issues would be to provide them with a flexible work schedule, to provide a rest space, a quiet area for them to for them to have some private time if they need it. A white noise generator or noise canceling headphones can also be beneficial in helping people not focus internally so much. Modifying their break schedule to provide more frequent short breaks may be beneficial. A support person or animal might be appropriate depending on the job and the individual and their environment. Looking at ways to reduce triggers for anxiety and depression may be helpful, and a good job accommodation evaluation may assist with this. And there are also many apps for mental health and stress and emotional management to help people track their moods so that when they speak with a mental health professional, they can help better map out and understand what is causing them issues. Shortness of breath. This is another one I've heard from several people being a big issue after having recovered from COVID-19. Several things that can be done is providing an alternative face mask, something that might be looser fitting or not quite as close to the mouth. There are some different devices that will help hold a face mask off someone's nose and mouth, making it easier to breathe. Allowing an individual as an accommodation to remove their face mask when it is safe for them to do so while on the job. Allowing them to have access to inhalers if they're in a work environment that would be, especially if it would be difficult, or they're not supposed to carry anything with them, like in certain types of warehouses, they may still need to have access to an inhaler quickly. Looking for ways to reduce physical activity through job modifications or ergonomic assessment. Allowing the individual to have more frequent rest breaks. And to reduce exposures to triggers. So, for example, if someone is in a large work area, say a warehouse or a large office building that they frequently have to walk across, to look for ways to reduce the amount of walking they have to do. Or if they have to go up and down stairs frequently, look for ways to modify their job tasks so they don't have to go up and down the steps. Again, a good job accommodation assessment can take a look at these things and help determine what might be appropriate. I've heard of people having cardiac issues after COVID-19. The acute phase of the disease is resolved. So again, with cardiac problems, job accommodations might include things such as reducing physical activity, allowing more frequent rest breaks, controlling temperature in the work area, especially if it's too hot or too cold, that can exacerbate cardiac issues, and reducing exposures to triggers such as toxic chemicals and smoke. And small, strong scents can also have an effect on people who have cardiac issues. Paresthesia. I've heard that this can occur. I don't know anyone who's had this issue, but paresthesia is when you have experienced numbness or tingling in your extremities, especially. Think about if your arm or leg falls asleep, if you're sitting in an awkward position. And possible ways of accommodating paresthesia would include an ergonomic evaluation, taking a look at the work area and seeing if we can improve the way things are positioned or the equipment that's being used. Wearing protective clothing and gloves may also be effective. If someone, for example, is using a tool that tends to vibrate a lot, there are anti-vibration gloves that will help protect their hand, and vibrating tools do tend to cause paresthesia in individuals. And also providing grip aids for tools, maybe thickening the handles, making them more comfortable to hold, may be beneficial depending on the person's job tasks. Another possible symptom of post-COVID-19 syndrome is dysautonomia. And this is a disorder that affects the parasympathetic nervous system. This is the part of your nervous system that controls autonomic functions like your heart rate, blood pressure, breathing speed, how much you sweat, digestion, other things along those lines. And so this is something that can be very problematic. Some possible accommodations for dysautonomia include allowing frequent rest breaks, allowing the individual to telework, again, in a more controlled environment, allowing temperature control in the work area, especially if the person is having difficulty with internal temperature regulation, allowing drinks at the workstation, doing an ergonomic assessment of the work area to see if there's anything that you can do to reduce the risks for that individual, and also having an action plan for a sudden exacerbation. So a common issue with dysautonomia might be plummeting in blood pressure, sudden drop in blood pressure, or sudden increase in heart rate, which is tachycardia. And this can cause a medical emergency. And so if someone is having symptoms of dysautonomia, It's a good idea to already have an action plan in place as to what you're going to do or what needs to be done when the person is experiencing a sudden issue with that. Dizziness and lightheadedness can also occur. And so for this particular functional limitation, we would look at providing fall protection and making sure that the person has either protective clothing on or is in an environment where if they were to fall that they're not going to hurt themselves. And so hip protectors, a head protector, wrist braces may be beneficial. Allowing a flexible work schedule. Again, someone might tend to be more dizzy or lightheaded in the morning or the afternoon. And so providing some flexibility in the work schedule may be helpful. Allowing the person to have rest breaks. Again, this might be appropriate depending upon the job. Looking at things that might trigger dizziness, such as issues with lighting or glare, and another possible accommodation could be to allow telework, because this does allow you to have more control over the environment in which the person is working. Tinnitus, I've only heard on the news that this has been an issue for some people. I haven't actually seen anything in any of the medical literature about this, but as a general accommodation for tinnitus, providing a white noise and environmental sound machine can help the person so they're not quite as distracted by the tinnitus. Tinnitus is a ringing in the ears, by the way, if you're not familiar with it. So there's usually a constant tone or ringing or howling or hissing sound that someone is going to hear. That's just due to some nerve issues going on. And so providing accommodations that will provide sound on top of that, so it's not as apparent, can be beneficial. If someone has severe tinnitus and they're having difficulty understanding spoken speech, providing real-time captioning can be beneficial. And there are a lot of artificial intelligence captioning apps. A very popular one's called Ava that can be loaded onto smartphones to allow face-to-face communication with AI captioning to help someone understand if they're having difficulty. And so the process, very basic way of requesting job accommodations. Under the Americans with Disability Act, an individual with a disability is entitled to accommodations if they meet the definition of a disability, if they're qualified for the position, and if they work for an employer that has at least 15 employees. And so the way an individual who is experiencing issues can make an accommodation request, the first thing is your employer might have a written ADA or accommodation request policy in an employee handbook that will provide you with guidance onto how to make a request at that employer. While it is possible to make a request in a face-to-face meeting or by email or fax, it is recommended that if you make a request, it is in writing so that you can have a copy of that documenting when you submitted your request. Your request, depending on where you work, may be submitted to your supervisor, a manager, or the human resources office. Your employer will most probably request some sort of medical documentation on your disability, which they can do. And when you make your request, something that should be in there is explaining why you need accommodations, what kind of accommodations you need. And it's a good idea, if you have some ideas as to what accommodations might benefit you, to provide that as well. So here are some resources on post-COVID-19 syndrome, or post-acute COVID-19 syndrome. So the first one is a website, a medical description as to what they already know about it. The second two links are to the Job Accommodation Network and some information that they've recently put together on long haulers, which is one of the terms that is being used to describe people who have long-term issues following COVID-19, and also a website from Jan from the Job Accommodation Network on how to request and negotiate a reasonable accommodation. Thank you very much for your time. If you have any questions, and if you're in Alabama and need assistance with job accommodations, you can contact the Alabama Department of Rehabilitation Services. And you can certainly contact me if you have any quick questions. My email address is michael.pap@rehab.alabama.gov. And I can also be reached in my office phone 205-290-4460. Thank you.
Visit our website at altechsymposium.net. Our next session will begin shortly. CEU close code 24248. CEU close code 24248. CEU close code 24248. Visit our website at altechsymposium.net. Our next session will begin shortly.